Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody, and thanks for tuning in for Direct Connection. Coming up in our health segment, we will focus on kidney problems and how to avoid them. First tonight, Maryland's highly regarded public schools are suddenly seeing some very poor test scores. Joining us to review the results is Jack Smith, Maryland's interim state superintendent of schools. Dr. Smith, thank you for being with us.
Thank you. It's good to be here.
First report we got a couple of weeks ago was called the PARCC test, which is a new test, and it aligns with the Common Core standards, correct?
That's correct.
And the numbers I saw, the numbers weren't really good anywhere, but in Maryland they were certainly not up to standards. Passing score, maybe 30-some% of students.
Of the 12 states that administered this particular next generation assessment last spring, Maryland falls somewhere in the middle of the pack. And in terms of the scores, they are very different than what we've been used to because the scores in Maryland historically started a baseline and climb, and so this is our baseline.
There was still disappointment, even among members of the Board of Education, with the numbers. What was the explanation?
That we started with a test that doesn't just ask students to recall discrete pieces of information, like what does this word mean or how do you add these two numbers. Instead, we're asking them to know what the word means and then look at it and from
text
draw conclusions about it and then support their answer from the text.
That's kind of how the Common Core is supposed to work? Yes. I mean, the test fits the curriculum.
Yes, the test is aligned to the new standards that we have here in Maryland. We call them the Maryland College and Career Ready Standards, and they're based on the Common Core standards. And it's all about outcomes. It asks students to be able to do things with the learning that they have.
The second set of results that came out just a couple of days later was called the NAEP test. And that's not a new test, and the numbers were disappointing there. 4th grade and 8th grade, English and math, and Maryland declined on all 4.
Yes, the National Assessment for Educational Progress is given every 2 years, and Maryland's scores did go down in all 4 areas on the 2015 assessment.
What do you make of that?
Well, in the reading language arts area, the explanation is pretty clear. Maryland school systems had been excluding students with special ed services and English language learners over time, and in 2013 those exclusion rates were quite high, and for the last 2 years we've been working with the school systems to change that exclusion practice.
So if you were to go back and exclude those kids, do you believe the scores would have been up to Maryland's normal high standards?
The NAEP statisticians that we spoke with on the phone before the release said that those exclusion rates would count for more than half of the drop, I think is what I remember him saying, in the reading language arts. In math, it's a different story. In math in 4th grade, we know in 2 of the 5 areas that there was a sequencing change in where we teach information versus when it's tested, and that was in geometry and data analysis, and those had significant drops from 2013 for us. In 8th grade, we had 1 drop, and that was in data analysis, and we need to dig into that. We need to dig into math in general.
What do other states do with respect to excluding special needs, special education kids from the scores? Where I'm going with this is that kind of the central theme of Maryland politics is that we have great schools here. And Governor Hogan was critical last week of the previous administration. I won't ask you to wade into the politics of it, but he said that the O'Malley administration was cheating on the scores, in his words, by excluding so many kids who scored poorly. What do other states do?
Other states have exclusion issues. Maryland's had been among the highest, though, in the last couple of administrations, and that's more of an evolution because Maryland has very strong special education guidelines and policies, and typically the policy is when you use an accommodation for a child in instruction or in a local test, that accommodation is used in any sort of state or national test. NAEP, the National Assessment for Educational Progress, doesn't allow for that exclusion to be used in what's called verbatim reading or read aloud. So over time, school systems have said, well, this child should be excluded because he can't have his verbatim reading services. And we needed to correct that because the NAEP test is a very different kind of test.
Whose call was it to correct it?
The call on exclusion was the person in the building looking at the list of students selected by NAEP. The call to correct it was Dr. Lowry's. I had just joined the State Department in 2013, and those scores came out, and she said, Jack Smith, as Chief Academic Officer, I want you to make sure the school systems understand this distinction and correct this exclusion rate. And so I spent a couple of years talking with school districts about that.
Let me remind our viewers, if you have a question about test scores or Maryland schools in general, please give us a call. We'll have the number up on the screen. You can also text us, or rather tweet a question. The Twitter address is @MPT News. I don't know, do parents get individualized reports on either of these tests? And if so, what should they know to interpret that?
There are no reports at all on the National Assessment of Educational Progress, the NAEP tests, except those state scores that you see. There are no local scores, there's nothing. And that's used to compare the 50 states in some way. As far as the new assessments that are called PARC, high school parents will be receiving individual student reports in the next few weeks between now and Thanksgiving, and elementary parents and middle school parents should expect those beginning about the 8th or 9th or 10th of December until the holidays arrive.
How should parents feel about the news coverage of all this, that the scores are down? Should that affect, or why shouldn't it affect their confidence in a Maryland education?
Well, I think that as a parent myself, all of my children are grown, I would have two feelings if I were to receive one of these. One of them would be that I would be encouraged that the goal is to have more rigorous standards for student success in the future, so that all children would learn what they need to know when they walk off the stage with a diploma. And they would have options and choices. So overall, good feeling. As an individual parent with one of my individual children, with 5 children, I can think about each of them. If I were to get this child's score, and I'd think if that child was a performance level 2, the first question I'd ask is, Mr. Teacher, Mrs. Teacher, what should I be doing to help my son as he struggles with his reading, as one of my sons did?
Where are you on the debate over high stakes testing? There are individuals, there's certainly the teachers union that thinks that we have too many tests and that the kids are under too much pressure.
Well, I think that the too many test question is difficult to answer because Maryland has local control. So the 24 systems all do very different things with testing. The state essentially gives one test in reading, one in math, and one in science until you get to high school, and then there's also one in government. So the state doesn't give a huge amount of tests, and we need those because they help us understand what's happening across the whole state in each system, and for really purposes of equity. The local school systems are having to rethink what they're doing with tests, especially event-driven tests where we stop the school day and interrupt the students' learning in their classes. And I think you're going to see a lot of backing off from that this year, next year, and in the coming years.
The president talked about this within the last week or two,
Yes.
and I can't remember what his threshold was, but it was some percentage of classroom time.
I think it was 2%.
Does that seem reasonable?
I think Maryland's state test would certainly fall well under that. And so I think it's an issue for educators and citizens and PTA to think about.
So is part of the issue here that with local county control, this transition to a Common Core system proceeded at a different pace in different counties?
It did.
And then we have this kind of global test coming in, and not everybody was fully ready. I mean, do you see differences in the counties?
Absolutely. And while the curriculum may have been fully implemented, it takes time to get into 1,450 schools in all those classrooms for those local school districts. So there definitely is what you just described, an implementation dip here and the baseline, and I expect we'll continue to see scores go up in the coming years.
Let's take a phone call in Montgomery County. This is Ralph. Ralph, thanks for the call. Go ahead.
Yes, hi.
Yes, sir.
Yes, my question is regarding the test scores and if you guys have an actual breakdown in the counties. I just moved to Montgomery County within the last year, and I have a concern about the Montgomery County area as far as how is the scores. How does that pan out, I guess, nationwide?
Thanks very much. I don't know if you know each county's scores, but broadly, what did you see? Maybe rural, urban, suburban?
Well, in response to the question, you can look at the Maryland Report Card website, and now you can look at high school data for each county. So you can see each county's data and each individual high school's data. And then if you want to, in terms of seeing any pattern between rural, suburban, and urban, I haven't looked at it so closely that I could tell you there's a pattern there. But you certainly see that systems that have typically performed well stayed in the top half, and systems that have not performed as well stayed more in the bottom half, although there's some rearrangement of that.
Let's spend a couple of minutes on languages
Sure.
and language education. With your background, having been an educator in Japan as well as the United States, you have an interest in that. Does that, well, there's two components. There's kids for whom English is not their first language, but then there's also people for whom English is their first language who are trying to learn something else. Does that get less attention in this era of high-stakes testing? It's not on the test.
It is not on the test. I don't know if I can say if it gets less attention, but I think that it doesn't get the attention it needs and maybe never has in this country. Both directions. We need to have really good systems for our English language learners, and Maryland's population has grown significantly. It's almost 8% of the state student population right now for English language learners. And the reverse of that is our students here in the United States whose first language is English are not learning world languages in the way that they need to in terms of our global competitiveness. It's absolutely essential that students learn more language, more of it, more often, and be more proficient in it by the time they leave high school.
Let's grab another call from Montgomery County. This is Lawrence. Lawrence, thanks for the call. Go ahead.
Yes, sir. Could you tell us, please, what percentage of the school budget goes to ESOL programs, and whether or not there is a correlation between the percentage of students receiving ESOL instruction and declining test scores?
Thank you very much for the phone call. And one thing I didn't get to was that the minority performance, minority achievement gap was widening in these tests, but go ahead.
Yes. In terms of the percentage of school budget, that would be different in each of the 24 school budgets. But for example, the callers from Montgomery County, where almost 25,000 of the 159,000 students in Montgomery County are English language learners. So I would imagine you're going to see a significant budget and a significant infrastructure there in terms of the state. And it would be an interesting study. We will look at what that means in terms of budget correlating to performance for our English language learner students.
Jack Smith is Maryland's interim state superintendent of schools. Dr. Smith, we appreciate the time.
Thank you so much. Good to be here.
Thank you very much. And just ahead, our health segment, treating kidney disease. We'll be right back.
A new season of Maryland Farm and Harvest is ready for takeoff.
We're using these vehicles for very good purposes.
And this dentist isn't just horsing around.
And as you can see, they don't really mind it.
I'm Joanne Clendenning. Don't miss the next Maryland Farm and Harvest.
Premieres Tuesday, November 10th at 7 on MPT. Honor the men and women who served bravely in Vietnam as MPT presents an unforgettable Veterans Day concert. Join the United States Air Force Band and Max Impact for top hits from the 60s and 70s as they perform your favorite songs from Benny King, The Four Tops, CCR, Jimi Hendrix, and more. It's a rousing musical tribute to America's veterans. Tuesday night at 8 on MPT.
What's coming up this week on Chesapeake Collectibles?
This is beautiful.
It's good to be czar.
As they say, yes. The beauty of this pretty little piece is when you flip it over and see the front.
Well, I think it's went back in the safe deposit box.
Wow. Holy moly.
We'll have that and more on the next Chesapeake Collectibles.
Thursday night at 8 on MPT.
Next time from Tulsa, Antiques Roadshow hunts for heirlooms and recent acquisitions.
Found this painting at a garage sale. The gentleman was asking $100 and I ended up talking him down to about $50 for it.
She told me I couldn't afford it.
Well, a good thing you inherited it.
This is catnip in the tray.
Hey, that's something. I never realized that.
Don't miss our discoveries from Oklahoma next time on Antiques Roadshow.
Tonight at 8 on MPT.
Joining us for this week's Your Health segment is Dr. Matthew Weir, professor of medicine at the University of Maryland School of Medicine and nephrologist at the University of Maryland Medical Center. Doctor, thank you for being with us.
It's a pleasure.
We want to focus on the kidneys. We each have two of them. What happens when something goes wrong there? When we talk kidney disease, what are we talking about?
You know, your kidneys are really mainly there to filter the blood and make it clean. They also get rid of excess water you consume and obviously the proteins in your diet. But the real problem is if the kidneys don't clean the blood well, the blood can then be very injurious to your blood vessels. And so what's quite interesting is that an objective measure of kidney function, which can be done very easily with a simple blood or urine test, is highly predictive of your risk for stroke or heart attack. So people with kidney disease are actually at much greater risk for stroke or heart attack than they are for progression of their kidney disease.
So while it may be easily diagnosed with urine test or blood test for the patient, they generally have no idea anything is amiss.
It's very unusual for people to have symptoms very early on in the disease process unless it's a very catastrophic form of kidney disease, which can rarely occur. Most kidney disease is a chronic, insidious, slowly progressive process, which robs you of your vitality as the cleanliness of the blood declines. And so most people don't know until too late.
What's the role of high blood pressure in this?
Well, the major issue with high blood pressure, it can be both a cause of kidney disease, but also a result of kidney disease. But the leading causes of kidney problems that we see are really an interrelationship between diabetes and high blood pressure.
Which are also easily diagnosed. Is it something, if diagnosed early, is there an advantage in kidney disease cases? What treatments do you have?
Absolutely. I mean, obviously, the big three that we look at for the care of people with kidney disease are blood pressure, blood glucose, and their cholesterol, because they all come together to injure blood vessels and can lead to heart and kidney and stroke problems. So what we really try to do is to gear much of our efforts to control those three things. And then if the person also has another kind of kidney disease, which could be immunological in nature, then we can specifically target that.
Let me remind our viewers, if you have a question about anything to do with your kidneys, you can give us a call. We'll have the number up on the screen. You can also tweet your questions. Twitter address is @MPT News. Why do we have two of them? We have one liver, one spleen, two kidneys.
Can't answer that question, but not everybody has two. But you really only need one good one. And it's the net number of little filters within the kidneys that really is most important for filtering and cleaning the blood.
So in cases of a kidney transplant where either the donor, a living donor, gives up one or the recipient just gets one, does that one work harder? Does it enlarge? Does it do something to adjust?
Actually, the younger the donor is, the more likely the kidney will hypertrophy or grow and start to accommodate more work. In fact, we have used very small pediatric kidneys from very young, unfortunate donors into an adult, and it'll grow right to the adult size. And even the remaining kidney in a donor increases its effort probably on the order of 20 to 30%. So there is a natural compensatory response to reducing the total number of filters if you donate a kidney. And we have good data now with kidney donors going out 40, 50 years showing that there is no adverse longitudinal outcome in terms of their overall health.
Kidney disease, does it affect certain groups, certain populations disproportionately?
Definitely. We have known that kidney disease can certainly affect people of African heritage more commonly than others. We have now learned that there are specific genes that people carry, which came down through history in large part because it prevented the risk for sleeping sickness in Africa. And when those genes are carried forward, they also increase the risk of kidney disease by as much as 10 to 20-fold increased risk. So it's very common to run in families. So we have to be very cautious about that. Also, Native Americans also have more kidney disease as well, and certainly anybody with, as I mentioned, problems with diabetes.
Let's grab a phone call. Baltimore City, this is Gail. Gail, thank you for calling. Go ahead.
Hi, Dr. Weir. It's Gail Gibson calling. I just want to thank you for all the good care that you've always given me. And I wanted to ask you, I'm in a lot of pain. I have some pain that goes from my hip all the way down to my leg, all the way down my shin.
Gail, I'm afraid I lost you there.
Okay, I have pain that goes down starts at my hip and it goes down my leg. Would that be possibly something to do with kidneys?
I would say unlikely not, save the possibility that you might have a kidney stone. Kidney stones can cause referred pain, probably not down your leg, but certainly into your groin or into the central part of your body. But the kidney stones can cause pain.
Do kidney stones relate to other types of kidney disease?
Well, it's interesting you ask that. People with kidney stones are at more risk for heart disease. There are studies illustrating that relationship. We're not really sure why, but it may be related to why stones form, either due to recurrent dehydration, higher levels of calcium in the blood. There are a whole variety of different possibilities.
Let's take another call. Baltimore City, this is Paul. Paul, thank you for calling. Go ahead.
Can you tell me how many people who've donated kidneys for kidney disease patients have ended up developing type 2 diabetes and eventually requiring kidney transplants themselves? Last time I checked, it was about 5 or 10 years ago, and I think there were a total of 40 then. There should be much more now.
Paul, thank you.
It's a very good question. We actually screen people carefully to make sure that they don't have any propensity for diabetes. So I think that's a very good point you raise, and it's possible that people who were screened in the past did not have a careful enough job doing that. It is true there are handfuls of cases of people who have donated and then gone on to require a kidney transplant themselves, but there are very few of them relative to the large scale of the number of donors that are done every year in the United States. We're very cautious and very careful in that regard.
Beyond transplantation, what's the most exciting thing happening in research now in your mind?
Well, I just came back from our national nephrology meetings in this past week. There are actually investigators who are actually harvesting kidney cells from somebody's kidney, growing them into healthier cells, and then re-injecting them into the kidney. So it's almost like using stem cells to have them naturally regrow some of their filters. So that's kind of a far out, kind of interesting option, but it's actually now being done in people.
Wow.
In an experimental way.
Science fiction. Well, and for anyone worried about their kidneys, a basic checkup is going to include the blood work or urine work that will tell you if the kidneys are.
Oh, absolutely.
Well.
I mean, even the National Kidney Foundation of Maryland here has routine free screening programs throughout the state. All you really need to do is get your blood pressure checked, get your blood sugar checked, and have simple tests of your blood and urine. It's very easy to screen. And again, earlier diagnosis, the better.
Dr. Matthew Weir, Professor of Medicine, University of Maryland. Sir, thank you for your time.
Thank you. Pleasure to be
Appreciate
here.
it. Thank you for joining us for Direct Connection. We're back Thursday at this time with your money and business and what consumers need to know about the state of agriculture in Maryland and the threat of avian flu. Now, for all of us here at MPT, I'm Jeff Salkin. Thanks for watching and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.